Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection. We're the last of our four-part series on emotions, and we're going to talk today about how to process sadness. And we have with us Lucy Barylak, MSW, and Elliot Sklar. Let me tell you about these folks. Lucy has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. And she would like you to know that she was a caregiver for her mom for about 10 years. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, in Florida, and virtually online. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally. His work is focused on the complexity of issues related to aging and caregiving. And with that, I want to thank you guys so much for being here with us today and for all the preparation you've done for us.
Thank you.
So good morning, everybody, and welcome. Thank you, Evelyn and Minerva. Today is the last of our series of emotions. We're going to be talking about sadness. Before I start, though, I do want to tell you that our session today is a 1-hour session, and you'll be able to ask questions, but we're also adding a special service at the end for about a half an hour. We're going to close the recording, and this will give people an opportunity to ask any personal questions that you may have. You could also change your name on the computer, and we'll let you know how to do that a little bit later on. So let's talk about sadness. You know, sadness is something difficult for most of us to process and cope with, and hard thing to talk about for many people, which is why we have dedicated one of our series to sadness. So sadness really is a normal human emotion that often occurs in response to something that's upsetting us, it's painful or disappointing situation. This emotion can vary in intensity. Like other emotions, it is temporary and lessens with time. Feelings of sadness can be intense depending on their source, but this emotion is also often accompanied by lighter moments. Even when you are sad, you may feel okay at times and comforted by those around you. You might feel better after crying or discussing your feelings with a friend. So let's see, how do we cope with sadness? So here are some ways to experience normal sadness in a healthy way and to allow these emotions to enrich your life. You might think, enrich my life, but we're going to let you know how this can happen. So it's so important to allow yourself to be sad. Denying such feelings may force them underground, where they can do more damage with time. Cry if you feel like it. Notice if you feel relief after the tears stop. So if you're feeling sad, plan a day to wallow. And I have to share with you, I do. If I feel sad, I give myself permission to just give myself one day to feel sorry for myself, and it does help. So what I'm trying to say is plan a day or evening just to be alone. Listen to melancholy music and observe your thoughts and feelings. Plan time to be unhappy can actually feel good and can help you ultimately move past the sadness into a happier mood. Think and write about the context of the sad feelings. Are you sad because of a loss or an unhappy event? It's usually not as simple as discovering the cause of the sadness, but to understand why you're sad and exploring those feelings can help you feel better. So let's talk about how you can make yourself feel better. So if you're really feeling sad, take a walk, Sometimes some fresh air and a little quiet time can change your perspective. Call a close friend or a family member. Sometimes venting your feelings can help you process them. But what I do want to suggest is please choose a person who is a positive thinker rather than a negative one, so they don't pull you down. Be kind to yourself. This may include a bubble bath, a nap, or even indulging in some chocolate. It's okay occasionally. It's fine to do that. Let yourself laugh. Find a favorite comedy, binge watch it if you need to, or find a funny YouTube video. One of the things that really helps me, I laugh at myself, because laughter just makes you feel better. Consider starting a gratitude journal, focusing on the positive, even if you can only think of one thing to be grateful for daily. It helps you shift away from the negative, sad feelings. However, remember that sadness can result from a change you don't expect or a signal that you need a change in your life. Change is usually stressful, but it's necessary for your growth. So if you're sad because you need to change something, think about the steps you can change to make your life more joyful. So for example, if you feel that you're really isolating yourself too much, maybe it's time to reach out to others as well. So these are just a few pointers, and we're going to talk a little bit more about that.
I can certainly relate to some of the tips that you shared as I think about it. When I'm feeling sad, I find I often like to watch old clips of Joan Rivers because I always get a laugh, and it does sort of pick me up a little bit. I was wondering, Lucy, if you could explain the difference between sadness and depression, because I think that's very important.
It is very important because there's a really big difference in that. Sometimes people say, oh, I'm so depressed. We have to be careful what we say because you could be sad and not necessarily depressed. Millions of people around the world experience sadness or depression at some points in their lives. However, recognizing the difference between a diagnosis of depression and the emotions of sadness can help a person process both in a healthy way. So let's look at what is sadness. Okay, sadness, as I said before, is a normal emotion that every single person will experience as stressful or sober times. A number of life events can leave people feeling sad or unhappy. The absence of a loved one, divorce, loss of a job or income, financial troubles, or issues at home can all affect mood in a negative way. Now, for some, even young people failing an exam, not getting a job, or experiencing other disappointing events can also trigger sadness. However, a person experiencing sadness can usually find some relief from crying, venting, or talking out frustrations. More often than not, sadness has links to a specific trigger. So that's important when we say identify what is actually making you sad. Write it down. Sadness usually passes with time. If it does not pass, or if the person becomes unable to resume normal functioning, this could be a sign of depression, okay? So sadness passes, but if it continues, you have to look out for that. So if low moods get worse or last longer than 2 weeks, the person should talk to their doctor. It's very important. So when we look at depression is a mental disorder that has an overpowering effect on many parts of a person's life. It can occur in people of any age. It really alters your behavior and your attitude. And many times it gives you side effects of being not well, pains, headaches, all kinds of physical symptoms. I want to share that in 2015, around 16.1 million people aged 18 years or above in the US had experienced at least one major depressive episode in the last year, accounting for 6.7% of all adults in the country. That's really a very high number. So let's look at some of these symptoms of depression. So there's really feelings of discouragement. You don't see the light at the end of the tunnel. And obviously there's an awful lot of sadness that doesn't go away by going for a walk. There's a whole sense of being hopeless, like you really feel hopeless. There's no way to turn this around. A lack of motivation, that's a big one. People are just not even motivated to do their daily activities. A loss of interest in the activities that individuals once found enjoyable. It could be that you're sleeping a lot more, or not sleeping at all. You're eating, you're not eating. And many people that are really, really depressed can't even seem to get out of bed. So that's the difference between depression and being sad. Sadness is, yes, you have to acknowledge your sadness. You have to give yourself time to wallow in your sadness. But it usually does go away, and you get, you're sometimes sad, but sometimes you're okay. Being in a depression, you're never okay. It's just continuous. So be very wary about that and be able to identify the two. I was just wondering if anybody had any questions at this point. Otherwise, we're going to continue.
So everybody, if you're on the phone, I have a little website. I can see if you unmute yourself by pressing *6. For those of you on Zoom, I am sure you all know how to get our attention at this point. You can unmute yourself. You can go to the chat room, or you can put your hand up.
All right. Well, we will continue on. And if something comes up, please feel free to type into the chat box. We'll also, of course, stop multiple times during our program for discussion and questions. And as Lucy said, we will be having our dedicated program extension, if you will, today. So I hope that some of you will join us to talk a little bit more about this. But I really want to thank you, Lucy, for helping to explain the difference between sadness and depression, because it's so important. And that element of how long the feeling lasts is so critical, because it can also be so disruptive to your ability to function. You talked a bit about hopelessness, and this is something a lot of people felt during and after the pandemic. Helplessness and hopelessness, which we know are hallmarks of depression. And statistics on depression have really changed post-pandemic, showing a marked increase in the overall depression that people are feeling. Now, we know that caregivers certainly have unique risks for depression. And this program on sadness, I think, is so important because researchers have also found that a person who provides care for someone with dementia, for example, is twice as likely to suffer from depression as the person providing care to someone without dementia. As stressful as the deterioration of a loved one's mental and physical abilities may be for the caregiver, dealing with dementia-related behavior is an even bigger contributor to the development of depression. Some of the symptoms of dementia, for example, wandering, agitation, hoarding, embarrassing conduct and resistance or non-cooperation from the care recipient, can make everyday challenging, and it makes it harder for a caregiver to get rest or assistance in providing care. The more severe the case of dementia, the more likely the caregiver is to experience depression, which is really, really critical for our caregivers participating today, and also healthcare workers to be able to help to identify signs and symptoms of depression. It's very important for these caregivers to receive consistent and dependable support and respite to be able to move beyond their experience of depression or challenge in their role. But it's really not just dementia caregivers. Women who are caregivers, for example, experience depression at a rate higher than men. Yes, women do provide the majority of caregiving in the US. Approximately 12 million women experience clinical depression each year, at about twice the rate of men. If you think depression is all in your head, think again. A Mental Health America study found that many women do not seek treatment for depression because they're embarrassed or in denial about being depressed. In fact, 41% of women surveyed in this study cited embarrassment or shame as barriers to treatment. And yet, if you think about it, women are socialized to be much more expressive and communicative than men, certainly about our feelings. So it's very interesting. Men who are caregivers deal with depression differently. Men are less likely to admit to depression. And it's actually one of the first things I learned when I started working as a professor in medical school was how to assess depression in patients. And you usually never want to use the word depression or depressed, but rather feeling blue, feeling down. These are words that men in particular were more likely to admit to. So men will more often self-treat depressive symptoms, for example, anger, irritability, or powerlessness with alcohol or overwork. I know, Lucy, you talk a lot about substance abuse, and this is a very big issue for male caregivers too. And what's interesting is that although male caregivers tend to be more willing, it seems, at least in the literature, than female caregivers to hire outside help for assistance with home care duties, they tend to have fewer friends to confide in or positive activities to engage in outside of the home. And this is something we've known for a long time, that men's social circles are smaller, and that's usually one of the reasons they have a challenging time after a spouse passes, for example, or if they are a caregiver. So the mistaken assumption that depressive symptoms are a sign of weakness can make it more difficult for people to seek help, which is so unfortunate. Certainly, mental health is by no means a question of strength or weakness. It's part of our health. So it's very important to get our mental and our physical health checkups, if you will, during a complete physical exam. Your doctor should ask questions about how you've been feeling, not just physically, but also overall. It's important also during the time that you may visit with a clinician to bring up feeling blue or down or depressed if you're feeling any of that, because it's important to get treatment. A lack of sleep is also a very, very big contributor to depression. And this is something caregivers certainly can relate to. While our sleep needs vary, I need a little more sleep today. A lot of people need on average 8 hours a day. Loss of sleep as a result of caring for a loved one can lead to serious depression. And the important thing to remember is that even though you may or may not be able to get your loved one to rest throughout the night, you can certainly arrange to get your own much needed sleep. For example, hiring a respite worker or engaging a friend to be with your loved one while you take a nap, finding a day center, or scheduling a stayover with another family member for a few nights. These are just a few ways to keep up your caregiving commitment while also making sure that you get the sleep that you need. Depression can also persist after placement in a care facility. This is something we hear a lot about. Making the decision to move a loved one to a care center is very stressful. And while many caregivers are finally able to catch up on the rest that they need, the loneliness, the absence of the care recipient, guilt, and monitoring the care of a loved one received in this new location can also be adding stress. So many caregivers feel depressed actually at the time of placement, and some continue to feel depressed for some time after. It's certainly not an experience in which people feel good or elation, and that's very understandable. People also assume that once the caregiving experience is over, the stress from providing hands-on care will go away. But research has found that even 3 years after the death of a spouse, for example, with dementia, some former caregivers continued to experience depression and loneliness. In an effort to return to their normal life, former caregivers might need to seek help for their depression. And in our programs, we've talked about anticipatory grief, which is a feeling of sadness ahead of knowing that someone is going to pass and that grief will follow. It's almost like grieving before the person passes. It can happen with a pet or any relationship that we have that we know is finite and limited in time. And it's a very common experience, and counseling can also be very helpful to allow you to better process the stages of grief. And this is something we're going to talk about a little bit later. I did want to ask if anyone had any questions or comments before we move forward.
Press *6 if you're on the phone, please. And if not, just unmute yourself. Go to the chat room, put your hand up. Love to hear from you.
There's an old saying to never analyze your life when you're feeling tired. And it is because when you're tired, you're more likely to feel down or depressed.
Are you depressed today, Elliot?
No, I'm wearing blue just in honor of our theme today. But I'm feeling good today. I was sharing ahead of our session that I had just come from the gym, and the gym is my antidote to sadness and feeling blue.
Good.
All right.
Sure. Thank you, Elliot. Yes, there's always that balance between am I sad, am I depressed? And I hope that it's really quite clear. There's a big difference between the two. And I think many times we use that word very loosely. I'm depressed, All right, so we received many questions about this topic, and we wanted to share one with you because it seemed like this person sort of had a lot of support for caregiving, yet felt sad. So let's read it. I'm a caregiver for my mother for many years. She attends a day center twice a week, as well as I receive some home help for her daily needs. I joined a support group, and I find it very helpful. The problem is that recently I find myself feeling very sad. I cry often, especially before I go to bed, but I'm not sure why. I was always a very optimistic person, but find it more difficult to be positive every day. My family and friends always tell me what an amazing job I'm doing and how strong I am. I feel strong. I don't feel strong at all. I know that I need to get some help, but I don't know where to start. Okay, so first of all, I really want to thank you for your letter. And I have to say, I'm really sorry that you're going through this difficult time because feeling sad doesn't really feel good at all. But you wrote that you don't know where to start, but in reality, you've already started to find help by writing to us. So, Elliot and I are constantly saying that it's so important to acknowledge that something is wrong. And that is the first step to really getting the help. So always acknowledge your feelings. And as I said before, don't hide them. I believe that it's important for you to identify the source of your sadness and write down all the feelings that come to mind and try to identify the reasons behind your sadness. And many times, all you have to do is ask yourself, is there anything I can do to make myself feel better? And as I said before, on a regular basis, do something special for yourself. And I think it's so important to give yourself permission to feel sorry for yourself, but it needs to be time limited. And that's why we're emphasizing that, the difference between. So if you don't start to feel better, it's time to call the doctor to make sure that the sadness does not turn into a depression. And again, reach out to people that you trust, that you feel are there for you, to talk about it. And all the other tips that I gave before, as far as going for a walk, being active, trying to find situations, listening to any funny story, just to sort of make you feel, to get that laughter back into your life. So,
Lucy,
yes.
sorry.
Go ahead.
I was just going to say, a lot of doctors who are so busy, they have so little time to spend with each patient. If you really feel like you need help and don't know where to start, I would ask your doctor for a referral to a mental health professional, or where to find somebody, how you can do that.
No, absolutely, Evelyn. That's always the focus, is that you don't have to do any of this alone, for sure. And and there's always resources that we are going to share with you. But your point is really well taken. Sometimes these days doctors don't have, and it's important for you to tell your doctor when you are seeing them that how you're feeling. And it doesn't have to be necessarily a psychologist. It could be a social worker, anyone that is there to listen to you. Venting is really good. You let it out. I guess at the end of the day, what I am trying to say is, don't hold it in. Don't be embarrassed by your feelings. It's important to acknowledge them.
And
And
that
it's okay
really,
to be honest with your family too and say, well, I don't feel strong. I don't feel amazing.
Yeah, if you feel that, yes, absolutely, absolutely, you can do. There's many other tips, obviously, where family, especially with this particular letter, where family can play a greater role in supporting you. But that's certainly something that she should be looking into.
absolutely. And it's a good follow-up, I think, to what we were talking about shame and embarrassment, because that seems to be one of the greatest barriers for people to seek out help. And we really need to flip the script and change the perspective on that completely.
100%. We're only human, right?
Yeah, absolutely. I was curious if anyone had any comments or any questions or anything that they want to share if they have perhaps found themselves in a similar situation.
Just press *6 if you're on the phone and I can see, or you can, let's see, we have Melody Chattel.
Hi, I'm Melody Chattel, as you said, from Austin. These sessions are very helpful to me. Thank you. Two questions or one comment and one question. I find my sadness, and I do think it's sadness, not depression, sadness along with frustration in not knowing how long caregiving will last. And I know I really cannot know that. No one does. I do get good information from our neurologist, yet I liken it to like running a marathon and you don't know when the finish line is going to come. So that is something I'd love a comment on. And then the question is, are there any studies that show differences between depression levels or frequency between caregivers whose loved ones are in communities versus at home?
Well, maybe I'll try.
Go ahead, Lucy.
No, I'll try the first one. I'll let you do the second one. It's very interesting what you're saying, because I'm going to talk a little bit more about that later on also. It's that whole anxiety about the future and anticipating things. That's what we're going to talk about, anticipatory feelings. But what I do suggest, what I think would be helpful to you, as what I was also talking before, is I would love you to write down your feelings. Like, what is it exactly that you are so concerned about and worried about? I think that's going to help you. For example, if you want to share now one feeling or not, or you could stay on with us later on and we can explore it a little bit more. But I'll just throw something out, I felt that way at a certain time when I was caring for my mother, the same kind of feeling. And I identified that feeling as extreme sadness. I didn't want to deal with the sadness. For some people, it could be guilt, So once you kind of identify it, you have a little bit more control to see how can you work with that. What is it that you need to do now in order to deal with whatever feelings might come later on? But I will be discussing this a little bit later on in the session. I hope that I've answered you a little bit. And if you have any other thoughts, please share it with us.
Thank you. That's helpful.
And I would be happy to answer your other question as related to depression levels of people who are in long-term care versus those who might be at home, and how the caregiver responds. There is research on the topic. What the findings show is that there are actually pretty equal levels of depression, stress among caregivers whose loved ones are in placement versus at home. But what I think the studies fail to capture, because a lot of them use quantifiable surveys, is the lived experience of that caregiver. For example, if your care recipient needs more care, help with activities of daily living, toileting, if the responsibilities grow to become so cumbersome, obviously that's going to have more of a toll on your mental and physical health, your stamina, your sleep, your stress. So that isn't something that was captured in those studies. I can see, for example, how placement could be of help to relieve, for example, toileting, issues of activity, daily living. But what I think is so important for caregivers is to establish some kind of routine, something that you have in your life now that you can carry forward with you, for example, once that person is in placement. What we have heard from the lived experience of caregivers is that that really helps them because there's something continuous in their life that is for them. Could be an exercise class, it could be a book club, something that you're able to perhaps get respite to do either at home or physically in your community that gives you some consistency and some level of support. Does that make sense?
It does. Thank you.
Of course. It's such a complex issue, and there are two kinds of research. There's qualitative research, which does interviews with people, and then there's quantitative research, which is more statistical. And that is the kind of research that we see that's more often published. But when it comes to caregiving, I think that the individual experiences of caregivers are so important, and they're not the same for everyone.
Rarely, yes. We have a chat, Elliot, if you want to pick it up.
Sure. Lisa shared, I think it is so important to find ways of living in the moment and of letting our minds get the best of us worrying about the past or the future. I have found living in the moment, I am more hopeful and happier regardless of my circumstances. It's a great comment. Thank you, Lisa. And
Mindfulness.
Mindfulness, we talked about that during our program on uncertainty. And I share for myself the experience of exercise. Just this morning, this 30 minutes on the elliptical, I am living in the moment for every one of those 30 minutes and cannot wait until they're over. I enjoy it, I look forward to it, but it's challenging in the moment. And it reminds me that if I can get through those 30 minutes, I can get through anything in my day. We have another chat from Lisa. I also think about what I can change and what is out of my control. And that's so true. So another chat. Mara shared, thank you for acknowledging that caregiving is not the same for everyone. Even caregivers have to understand this communicating with one another. Absolutely. The experience is different. It's different based upon the level of need, the relationship that you had before caregiving, the relationship you have during. There's so many personal factors. So I'm going to get on my soapbox. If you think that you might be depressed, please, please, please speak with your doctor. Why suffer? Why suffer? If you're a caregiver and you're caring for someone who is suffering, perhaps don't add suffering on top of suffering. It's very important to speak with your doctor. Our mental health is of equal, if not more importance, in my opinion, than our physical health. They are intrinsically linked. And again, why suffer? I know that many people have concerns about side effects with medications, for example. And if you do have any questions about that, I'm happy to answer them to the best extent of my ability. Sometimes I think of myself as an ambitious psychopharmacologist. I love to learn as much about all of these new medications as possible and how they work. Now, of equal importance, it's not uncommon for a person receiving care to suffer from undiagnosed depression, something we don't talk very much about, but care recipients can be depressed. For example, it can be very difficult if a person is cogent to be in a position in which they need care. Aging at the best of times can be depressing if it comes with diminished health or quality of life. And that is one of the reasons why many seniors experience depression. So if this is a concern, please speak with your care recipient if they're able to communicate about how they're feeling, or perhaps with their healthcare provider as well. So it's not just for yourself, it is for your care recipient too. And we need to think of our health more holistically. So how is depression? Yes, please, Evelyn.
It brings me back to when you talked about compassion. Having compassion, being kind to yourself, I mean, getting help when you need it is the ultimate compassion. Take care of yourself. And in the process, you're going to be able to take better care of your loved one.
Absolutely. I'll toast to that. Many people actually don't want to approach depression with a provider because they're not sure about how depression is actually identified or treated. And the first step to getting the best treatment for depression is to meet with a mental health professional. Just like you said, Lucy, it can be a psychologist, a social worker, a family counselor, any type of licensed therapist. And at the same time, if you haven't recently had a physical, schedule one with your doctor. For many people, it's important to know, because it's not obvious, there is no blood test for depression just yet. There are other measures like scales that doctors use to ask questions and ascertain if a diagnosis of depression is warranted. And only a doctor or your primary care physician or a psychiatrist can prescribe medication. That does depend on the state in which you live. Some states have different rules, but for the most part, that's the standard rule. And that's why it's important to see your doctor in addition, for example, to a social worker or a psychologist. And sometimes they'll work together and be in communication to work on a treatment plan that is best for you. So although they may prescribe, and by they, I mean the doctors again, antidepressant medications, medication alone is not the most effective treatment for depression. Concurrent guidance of a mental health professional is strongly, 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 strongly recommended. Do I emphasize that enough? The therapist or counselor will listen to your concerns, screen you for symptoms of depression. They can pay attention to better changes in your mood, for example, whereas we know from 2021, I think that there was a study that showed that the average doctor only spent 21 minutes with a patient. So that's not a lot of time to be able to talk about your feelings, and that's where mental health professionals come in. It's important as well that they help you with addressing old patterns and helping to build new coping patterns. One way to find a mental health professional is to ask perhaps a friend or someone in your community for the name of someone that they know and trust. Same with your doctor. Or if you're employed, you may want to check your employer's health insurance provider list, or what's known as the Employee Assistance Program, EAP. EAP is actually a pretty wide benefit that gives you roughly 6 therapy sessions with a counselor, and they can actually be very helpful, not necessarily to just orient you to therapy and to treatment, but also to give you a free test run, if you will, with different providers so you can see who you feel most trust and comfort with. It's not uncommon also for people to know to request a free introductory phone meeting to help determine if the person that you're looking to see is a good match for you. What is very important for you to clarify is what the cost will be, how much your insurance will pay, how many scheduled sessions you should expect to have with your therapist based upon your goals and your particular circumstances. And any treatment plan really should be evaluated on a regular basis to ensure that it continues to contribute to your improved mental health and growth. And I see that we have a chat here. This series on emotions and the many WellMed sessions have helped me extremely because it validates my feelings and provides good suggestions to deal with many emotions and the exhaustion of caregiving. Thank you so much. Thank you so much for that comment. I'm glad that this is helpful. Certainly, that is our goal here, and we're glad that so many of you have found this series to be helpful. Something we may want to offer again later in the year. There's always new stuff that comes up. I did want to talk about treatment, as I was saying. I've gone over some of this already, for example, your insurance information, but I also wanted to talk about the fact that sometimes an initial medication, an antidepressant, might not be the right fit. For example, medications can be used in combination with one another. The most frequent treatment for depressive symptoms that have progressed beyond the mild stage is an antidepressant, which provides relatively quick symptom relief And by that, I mean about 6 weeks. It's not like a medication that you would take for an antibiotic or something. And it depends on the person too. For some people, people feel effects in a few days. And for others, it might take 6 weeks. So it's very important to be patient. And again, during this period of time, to be open and communicative with your doctor about symptoms you might be feeling. Some people have sleep disturbance with antidepressants. That's an important symptom to discuss. And that is also why it's important to have a therapist to speak to about your experience. Discussing your situation with a therapist can provide new self-awareness, for example, for also addressing certain emotional concerns that you might have and can help you to get and stay healthy. So when you do choose a therapist, I want to recommend that caregivers ask therapists about their experience working with family caregivers and their understanding of caregiving-related stressors. Also, if drug therapy is recommended, you want to make sure that you engage any clinician that you're seeing, a mental health counselor and your primary care physician, for example, in working together to help through that trial and error period. Also, older adults have different side effects from medications that can be potentially more dangerous. So it's very important to talk about any other medications that you might be on with your doctor, and also to be very attentive to any side effects that you might be feeling, because dosages might need to be adjusted. And that's a main reason why many people who initially get prescribed antidepressants go off of them, because sometimes there is a bit of an adjustment period that you have to go through. A lot of information. Any questions, or do you want to save it for our after session today?
Yes, there are lots of information to grasp onto. Okay. All right. So if there are no questions right now, I want to talk about anticipatory grief. That's what one of the ladies was, one of our participants was talking about. It's something that came up in our series before a few weeks ago by one of our caregivers as well. So that's why we wanted to talk about it. So anticipatory grief, also referred to as anticipatory loss or beginning grief. This is the distress a person may feel in the days, months, or even years before the death of a loved one or other impending loss. This is very common among caregivers of people with later stage degenerative diseases like Alzheimer's, Parkinson's, or MS, or even terminal cancer. So anticipatory grief in age, the younger a person is, the more severely they may experience this, particularly as it relates to death. In a review of 15 studies exploring these issues, doctors at the University of Illinois at Chicago found that younger caregivers and younger patients tend to report higher rates of anticipatory grief. So one of the reasons for this is that it's forward thinking, like looking into the future, So younger people tend to be looking forward. Or it's not surprising that younger caregivers reported more anticipatory grief, which is really the grief of what we still believe that they might lose, But you don't have to be younger to feel that way. It's very normal that a lot of caregivers feel, like they're so anxious about what's going to happen. This leaves, but in a way, it leaves space, however, for unrealistic expectations, for sure. So let's look at what you might feel when you're experiencing anticipatory grief. And it's not, you could just be experiencing one or all of these symptoms. The whole idea behind it is like you're so anxious about it that it becomes consuming. But you could be angry, irritable. Anxiety is a big one. You're always thinking about that and you just can't seem to get away. And many times denial comes to play into that. You really don't think the person is as bad as they are because you don't want to really deal with the situation. There's sometimes a desire to withdraw from social situation. And obviously, many times it turns into depression and dread. Guilt is a big one, That's why we always say, write down your feelings. What is it that you're feeling about this? If it is guilt, possibly, well, what can you do about that? An intense preoccupation with the dying person. You're constantly thinking about that, or you're constantly thinking about, oh my God, what if they have to be placed? You're not motivated. You have feelings that you're just kind of not motivated to even engage in your daily activities. Loneliness plays a role, loss of control over one's emotions many times, obviously sadness, there's tearfulness, all these emotions come to play. So some ways to, there are some ways to cope with this. So it is, if you're experiencing any of these feelings, it's important to talk about it with someone. Grief is a universal human experience. Common counseling intervention is so important. People need to have the opportunity to really talk about it, to really understand why they're feeling the way they're feeling, and to possibly deal with the situations, all these feelings and the anxiety that comes with it. And again, it's really important to not isolate yourself, lean on friends and family who are understanding and supportive. Accept that how you're feeling is important. Again, it's acknowledgement. And it's really so important to stay physically well, to eat well, and to just get a lot of rest and to really take care of yourself. All right, so we've said an awful lot. And I'm just wondering again to give people an opportunity to, if this is a new concept of anticipatory grief, if you want to ask a little bit more questions about it, now is the time.
And it's interesting because so many of the things on this list overlap with the symptoms of depression.
Absolutely.
That's a very good point you're making, Evelyn. It's very important because, what is important is to recognize where you're at. So if it is anticipatory grief and you're not dealing with all of these, maybe just one of them, it's important to talk about it so that it doesn't turn into depression. The same thing goes with sadness, obviously, is to be able to deal with it. Sadness, it's easier to deal with because you have a little bit more control about what you can do to make sure that you don't get into a depression. Because depression, a clinical depression, is it's many times you definitely need or possibly need medication, as Elliot was discussing before.
And I think the critical piece is the time, the duration. So if you're feeling sad for a long period of time, or you might be experiencing anticipatory grief that has a long duration. So absolutely, those experiences can feel very similar and they overlap. Depression can certainly be a part of anticipatory grief and something that you may want to seek treatment for with medication and counseling as well. So
sometimes people don't need medication. My experience has been that, sometimes it's really figuring out new skills, the kinds of skills that you two have been talking about, to help yourself react differently to things, skills, coping mechanisms, really going through and working with people on exactly what it is, that they can do. Like you've talked about, if you write it down, if you figure out a way how you can cope with it, a lot of times a therapist can help with that, and they don't need medication.
I agree with you, but I will say I think everyone's different. And I can speak from personal experience in the months leading up to my mom's passing, when her cancer was terminal. My feeling of anticipatory grief and stress as a caregiver who lived far away was very hard for me to deal with, and to also work full time and have other responsibilities as most caregivers do. And so staying on a medication for a temporary time during that period helped me to feel like I could tread water better. And I think that that's something that many caregivers feel. And there's nothing wrong with, for example, needing to go on a medication short term. It doesn't have to be something that you're on for the rest of your life. And that, in conjunction with counseling, can give you a little bit of a boost that some people might need. During that time, I likened my feeling to being in quicksand, and I could keep afloat, but I couldn't really get out of the muck. And medication helped me to sort of rise above it. And that might be true for other people as well. What I think is important, and we'll end on this note, is that, certainly this too shall pass. One of the things that's come up in this series from some of our participants is that 10-10-10 notion of, will this matter in 10 minutes, 10 years? Well, the same can be said, well, how will I feel about this in 10 minutes, in 10 weeks, 10 months? And that's important because it's important to realize that perhaps this too shall pass. Now, sadness is a very difficult emotion for people to talk about, which is why we're here today and why we will have our discussion following today's presentation. Yes.
I was wondering, how does one approach this discussion with the person? So as a caregiver, how much of this is useful to talk to the person you're caring for about?
Very important, and it's an excellent question that you ask. If you find that that person might be disengaged or seeming to be down, you can ask them about it. But if you have the ability to also be with them at a provider appointment or to speak with their healthcare provider, you can make your concerns known as well and leave it to them to discuss with your care recipient too.
And I was actually thinking more about talking about my sadness with them about the situation, not about what they're going through, but as you had mentioned, it's going to possibly be stronger for me than it is for them, especially female to male.
Absolutely. Lucy, please.
Well, it's a really good question that you're asking. And my first response would be to you is, I guess you feel that you have a need to tell them. So I think it's important first for you to identify why you want to tell them. I don't know what situation this person is in, what their cognitive abilities are, but it is important. And if you feel strongly that it is important that you want to let them know, then you should take that opportunity to tell them. I always feel very strongly, again, it depends on the relationship that you have with an individual. It's a time, maybe you can sort of a creative space where you're having a cup of tea, or you can reach over and take their hand and share in your own words. And once you understand why you want to share this with them, is to let them know that that sometimes you are feeling a little bit sad and express that. But I really believe that you have to be very conscious of why you want to tell this person how you're feeling. And again,
I think that does help. Yeah, to know why. And, for me, it just kind of feels like a lie if I'm not, because we're so used to telling each other so much. And if I do have a funky behavior, and now by listening to some of this information, I can figure out why I had the funky behavior, I can also share that. So it's not just another unknown thing that we're dealing with.
Exactly.
Yeah.
And that person better than anyone, and the approach is very, very important. Obviously, it has nothing to do with you, it's to do with me. This is how I'm feeling.
Mm-hmm. Mm-hmm. And
Thank you. I appreciate that.
Of course. And if you want to stay on with us after the hour to discuss this a little more, I have some other tips to share. I'm sensitive to the time, so we need to wrap up our formal part of the presentation. I do just want to especially thank Minerva for having brought up a great resource last week, in the sense that many healthcare providers are now offering mental health counseling via video or telephone, telehealth. This is really a great option for caregivers who might not have respite to be able to go to a physical appointment. And there is research to support the importance of use of telehealth for helping to support the mental health and lessening of depression of family caregivers. So the programs like the ones we're running today and working through, These are very helpful, and I hope that our participants will join other programs offered by WellMed, which I will let Evelyn talk about. And of course, as always, our references and resources are here, and we will be sharing a copy of our slide presentation with everyone who registered.
And there is one more chat. The caregivers I work with in a support group seem to have different levels of anticipatory grief and sadness if they're dealing with a parent versus a spouse.
Excellent point. And we hope that you will stay on if you can after the hour for our extended discussion where we can talk through some of these things in greater detail.
Yes, thank you so much. Well, I have a little housekeeping, and then I'll stop the recording and leave you folks while Lucy and Elliot do their support group, which I think is pretty fabulous. But I did want you all to know you're going to get a questionnaire in a week or so, and it will ask for your opinion. We hope that you give it. It will also come with the resources. If you have not registered for this session, if you got the number or the link from someone else, you will need to register with our customer service representative at 866-390-6491. That's the wonderful Minerva that we talk about. That's 866-390-6491. And you'll be really happy you did it, because then you'll get a copy of the monthly calendar. And we have 2 more sessions left this month. Excuse me. Tomorrow, Jamie Heisman, who's very entertaining, is coming on to talk about time to say goodbye, how to eliminate toxic people from your life. And that's a tough one, because a lot of times those toxic people are family members, who are giving you trouble about what you're doing and making your life miserable. Then the other one is on Tuesday of next week, Understanding Grief and Loss, which would be a nice follow-up to this presentation. So I want to thank you all so much for being here with us today, for your great questions and comments. And I'd like to thank the WellMed Charitable Foundation for their support, and thank you caregivers for what you do every day. And I hope you all have a great day. And I'm going to stop the recording at this point and hope that you will stay on. They're going to take a 2-minute break, and then everybody will be back in front of their cameras or on their phone. So bye-bye, everybody.
Thank you, Evelyn. Thank you so much.
Thank you.